were hit by a car out there in the street this afternoon and was injured, and I did nothing, and that person died, I would be indicted and convicted of negligent homicide. There is a state law against doing nothing when somebody's life is in danger. For health insurance companies, negligent homicide is legal. It's every day, every minute of every day, health insurance companies deny payment, letting people die so they can just simply make more money. Because mostly poor people die, they are certainly guilty of negligent homicide. But that's not all. I believe if I do nothing about it, if I'm silent to protect my job, or to protect my career, or to protect my resume, or to protect my standing in society, or protect my reputation with my friends, if I do nothing, I am an accessory to the crime. I too would be guilty of negligent homicide. So that's why I'm here today.
This is a really important action. And as you know, I'm with Physicians for a National Health Program, a group of over 16,000 physicians nationwide who believe that healthcare is a human right and that our health reform should be based on healthcare and not insurance company profits. For the last few decades, the situation has been getting worse for patients and for providers. Until as providers, we've been pushed into a situation where we are required to see more and more patients and spend more and more time fighting with insurance companies so that our patients can get the care that they need. And for so long, we've been putting up with that. As providers and as patients, we've done whatever they've asked us to do. We've jumped through whatever hoops they wanted us to jump through. But now is the time to say that we aren't going to do this anymore. Our health outcomes are so poor. We have the highest infant mortality, highest maternal mortality. We have the highest number of preventable deaths in this wealthy nation, and we have to stop playing their game and start speaking out. And that's why your action is so important, and thank you for inviting me here today.
As the government has given these corporations more rights than my kids would have if they got sick. And the reason we have the corporations is the profit before people. This is all tying in.
Is America's citizen concerned about our obligation as a signatory to the Uniform Declaration of Human Rights that Americans, all Americans, receive health care as a right? And as a Christian, I'm concerned with social justice, and this certainly is a part of the social justice that Americans are called to provide.
I'm here today because I don't like how insurance companies can take and take and take and you can't do anything about it. We are here to make a stand and make sure that everybody gets health insurance and everybody gets cared for. That's
I'm Chris, and I'm here to take a stand for health care for everyone, no exceptions, because health care is a human right.
I'm Ed, and I'm here because some folks in my family don't have insurance. They don't have Medicaid. They don't have Medicare. And we need to fight hard for H.R. 676, where everybody's in, nobody's out, and it's 67% of the people in this country want H.R. 676.
Insurance companies are investor-owned corporations, and they make their decisions like all investor-owned corporations based on what kind of profit they can generate for their investors. So when they deny care, it's based on that, not what's based on medical need. And when we prescribe a medication or we've authorized a course of treatment and it's turned down by the insurance company and we call their office to appeal that, we're speaking to administrators with no medical training. And so we say that insurance companies are practicing medicine without a license. They deny care based on pre-existing conditions, and you should know that here in Iowa, you don't even have to have an illness to be denied on the basis of a pre-existing condition. If you have the symptom of an illness, even if it was not diagnosed or treated, you can be denied coverage for that condition. And they are allowed to look back at a 60-month history of your health history here in Iowa to determine whether you have had a symptom of a pre-existing condition, and they are legally allowed to permanently say that they will not cover you for that condition. In addition to that, they are allowed to practice what is called rescission, which means that if they sell you a policy and then you get sick, they can look back and find a reason why they should not have given you that policy in the first place. And even though you've paid hundreds or thousands of dollars into that policy, they will cancel you. And that's legally allowed to happen by law. And as a result of this across the nation, as I said, too many people are not getting health care. Too many people are dying. We're watching the tracking polls. We're seeing that the number of Americans reporting unmet health needs, who are delaying care, not getting their prescriptions filled, is rising rapidly. The most recent figure was in, I think, April or June, was 59% of Americans are delaying getting the care that they need, and that has to end.
I'm Renee. I'm part owner of this company. Let's hope I can get some information.
A significant portion of your revenues are paid by tax dollars. We understand that as much as 40% of the premiums you collect are paid by public employers. When the public makes such a significant investment in a private corporation, particularly an investment so directly related to the quality of life and the survival of the public has a right to know how this investment is being administered.
I'm sorry, Lenny. Oh, this is Frankie's turn.
A detailed list for each individual below of any enterprise, private or nonprofit, for which that individual serves as a consultant, including any compensation, including but not limited to salaries, commission, and stock options received from that enterprise.
This statement and letter is from the Des Moines Catholic worker community and People for Healthcare for All. Now, we read this statement. We really would like to give it to Mr. Forsythe. He got mostly in all these questions a month ago. He had plenty of time to answer it, so can we see Mr. Forsythe? We got business with him. Public business, people's business, moral business.
Mr. Forsythe is not available.
That's tragic. We're going to stick around. I'm sure he's going to eventually show up for work, and we're here.
Well, at this point in time, he is not available, nor is any one of his deputies or any of those listed, and will not be available.
We'll just wait around.
See if they change their mind.
Okay. Well, then, at this point, you are causing a disruption to our business. And please be advised that this area that you are in is private property belonging to Wellmark. I'm asking that you leave Wellmark's property now, and if you choose not to leave, we will contact the Des Moines Police Department that you are disrupting business and trespassing.
Could you tell us what your name is, sir, and who you are?
I'm Richard Worth. I am the Director of Physical Security for Wellmark. I will ask you again, please leave Wellmark's property immediately. You are causing a disruption to our normal business operations and our trespassing. If you do not leave immediately, we will request that the Des Moines Police Department remove you.
So right now is your final chance to leave.